Hello everyone, welcome to the YouTube channel of Shree Swaminarayan Physiotherapy College SSPC, Ahmedabad. I am Dr. Dhara Desai. I am MPT Cardiorespiratory and working as a lecturer at SSPC, Ahmedabad. In this video, I am going to tell you about lung volumes and capacities. Lung volumes and capacities basically evaluate the mechanical function of the lungs. That means how much amount of air is going in, coming out and stored inside the lungs. That is basically measured by a device called a spirometer, and the test is called as pulmonary function test, and it measures lung volumes and capacities. They are related to the person's age, body weight, gender, body positioning, and they are altered if any underlying pathology or any disease is present. So, the graphical representation that we get with the help of spirometer is called as spirograph, and the paper on which this comes is called as spirogram. Traditionally, the spirogram used to have a tank-like structure and a graphical scale and a marker which will mark the entry and exit of the air. The volume will be marked on the marker. The person uses a mouthpiece to inspire and expire the air, and the volume is measured on the marker, and the graphical representation or the spirograph will come. But nowadays, the advanced spirometer comes with a computer software and has a detachable spirometer and a nose clip which is used. Portable spirometers are also available in the market, so they can be easily carried away anyway. Now let us discuss about the volumes and capacities. So there are 4 volumes and 4 capacities. The volumes are tidal volume, inspiratory reserved volume, and expiratory reserved volume, as well as residual volume. And the capacities are inspiratory capacity, vital capacity, total lung capacity, and functional residual capacity. So first let us discuss the volumes. The tidal volume or TV. It is the amount of air that is inspired or expired during relaxed inspiration or expiration. That means when the person is breathing normally at rest, so that amount of air is called as tidal volume. The normal value of tidal volume in a healthy young adult is approximately 500 ml. Next is inspiratory reserved volume. So it is the volume of air that a person can inspire after a resting inspiration. So this is the volume of the air that is inspired forcefully or with deep inspiration. So the value is approximately 3000 ml. We will discuss the volumes and capacities theoretically here, and in my next video I am going to share the practical purpose of the same. The next volume is expiratory reserved volume. It is the amount of air that a person can expire after normal or resting expiration. So after tidal expiration, the amount of air that is blown out forcefully, that is expiratory reserved volume, and the value is approximately 1000 ml for a healthy young adult. The last volume is residual volume. Residual means that is left behind. So the volume of air that remains inside the lung after forceful maximum expiration, it is called as residual volume. So this shows that the lungs does not get empty fully after the forceful expiration also. Yes, so some amount of air remains inside the lungs, and that is called as residual volume. The normal value is 1500 ml in healthy young adult. Let us discuss the capacities now. So basically the capacities are a combination of 2 or more volumes. First capacity is inspiratory capacity. It is the volume of air a person can inspire forcefully after resting expiration. So after the resting expiration or the tidal expiration, the amount of air that is inspired forcefully is called as inspiratory capacity. So it is the combination of tidal volume as well as inspiratory reserved volume. Why tidal volume? Because normal inspiration is there, and inspiratory reserved volume is because forceful inspiration is there. So it is combination of both TV and IRV. So the value is approximately 3500 ml for inspiratory capacity. Next capacity is functional residual capacity. Again the residual word is coming. So it is the amount of air that is remaining inside the lungs. Okay. So functional residual capacity is the amount of air remaining inside the lung after resting expiration. So resting expiration is there, so tidal volume is excluded. Residual volume is there and expiratory reserved volume is there. So it is combination of both residual volume as well as expiratory reserved volume. And the normal value is approximately 2500 ml. Now the next capacity is vital capacity. So it is the volume of air a person can forcefully expire after forceful inspiration. Both the things are forceful and maximum. So after maximum inspiration, the amount of air that is expired maximally or forcefully is called as vital capacity. So it is basically the combination of tidal volume, inspiratory and expiratory reserve volume. So combination of 3 volumes, and the normal value is 4500 ml. The last capacity is the total lung capacity. The name itself suggests that it is the total lung capacity. That means the total amount of air that can be stored in the lungs. So it is the volume of air contained in the lung after maximal inspiration. So it is combination of all the volumes, tidal volume, inspiratory and expiratory reserved volumes and residual volume. And the normal value is 6000 ml. So this is the total amount of air that can be stored inside the lungs. Why the lungs volumes and capacities are important? To distinguish between the different diseases and to distinguish between the different gender, different positions, etc. This is the graphical representation of the spirograph. Here you can see the center one is tidal volume. This is inspiratory reserved volume, that is the forceful inspiration. Here it is the expiratory reserved volume, the forced expiration. And beyond that is residual volume, that is remaining inside the lungs. Okay. Now the combination of tidal volume and inspiratory reserved volumes is inspiratory capacity. Then the combination of expiratory reserved volume and residual volume is functional residual capacity, and inspiratory capacity is done. Vital capacity is the combination of 3 volumes, that means the tidal volume, inspiratory reserved volume and expiratory reserved volume, that is vital capacity. And combination of all the volumes is called total lung capacity. So now, what would be different in the person's PFT if he is normal and if he is diseased? So there are basically 2 classifications given for pulmonary diseases. One is obstructive and one is restrictive. Obstructive lung diseases are like asthma, emphysema, chronic bronchitis, COPD. And restrictive lung diseases include pleural diseases, means pleural effusion, pleurisy, etc. as well as the diseases of the lung parenchyma, that is cystic fibrosis, pneumothorax, hydrothorax, empyema, etc. Basically, in obstructive lung diseases, there is more problem related to expiration. That means the expiration is hampered more than the inspiration. So in obstructive lung diseases like chronic bronchitis, emphysema and asthma, there will be inflammation of the mucous membrane. The production as well as the retention of the mucus will be increased. The airways will be narrowed, the lumen will be narrowed, and there will be destruction of the bronchoalveolar walls. So there will be problem in the removal of the air from the lung. As I said, expiration will be more hampered, more affected. So the patient will be having air trapping inside the lungs. The lungs will be having more amount of air in, because the lesser amount of air is getting expelled out. That means residual thing is more. Residual volume will be more. Functional residual capacity will be more. So in obstructive lung diseases, the residual volume will be increased and expiratory reserved volume will be decreased because there is problem with expiration. The vital capacity is decreased and the total lung capacity will be increased because the lung will be hyperinflated. Residual volume will be more, so the lungs can store more amount of air than the normal persons. Now let us discuss about the restrictive diseases. So in restrictive diseases, overall capability of the lung of inspiration as well as expiration will be decreased, because they cannot expand fully as well as they cannot expire the airs nicely. So overall all the lung volumes and capacities will be decreased. Here you can see the graphical representation of all the lung volumes and capacities in normal ones, restrictive ones and obstructive ones. So in restrictive, all the lung volumes and capacities are decreased, but in obstructive the total lung capacity is increased as well as the residual volume is increased. So here we are done with lung volumes and capacities. These are my references. If you have any questions or queries, please do comment on the YouTube channel. For more updates, please like, share and subscribe to our YouTube channel. Thank you.